Hello all. Today we are going to be celebrating World Voluntary Blood Donation Day, and Columbia Asia unit of Manipal Hospitals will be creating this awareness program to help answer all your queries regarding blood donation. Currently in this pandemic situation, I'm sure all of you must be having extra queries regarding the same, and this all will be answered by our expert in the house, Dr. Jayashree Kulkarni. I'm introducing her. She's the consultant pathologist and the blood bank officer at Columbia Asia Yeshwantpur Referral Hospital Yeshwantpur, and she has more than 15 years of experience in this field. So hoping by the end of this awareness program, all your queries will be answered.
Thank you,
Dr. Jayashree.
Thank you.
Okay. So since we all keep talking about this voluntary blood donation, why do we have to promote this voluntary blood donation so much?
Okay. So Voluntary Blood Donation Day, the World Voluntary Blood Donation Day, is celebrated every year on June 14th. This is in remembrance of Karl Landsteiner, who was the person behind the discovery of the ABO blood groups. He even won the Nobel Prize in 1930. So this is one day where we want to create more and more awareness about the voluntary blood donation, because every now and then we are facing a shortage of blood and blood component supply. What happens is, usually whenever donors approach the blood bank, we find that they come only for donating blood for their relatives or friends. So it very rarely happens that they come on their will, of their own will, to come and donate blood. What the advantage of voluntarily coming to the blood bank, that we are sure that this blood is going to be safe. How is it so? Because if you are coerced into donating blood, maybe by force, then there is every chance that you are going to hide some important history which can be dangerous to the patient when we collect blood. So that is why we want people to have this awareness about voluntary blood donation. What are the different myths and facts about blood donation, and also to thank the donors who have come to our blood bank and donated blood and help save multiple lives during this, especially during this COVID pandemic.
Correct. Voluntary blood donation is literally the highest humanitarian service awarded to anyone, because you are unexpectedly doing this to someone who you don't even know who the blood is going to.
Absolutely.
So it's extremely important that you step out, and she said it is completely safe. So when you say safe, Jayashree, what do you mean by safe? How safe it is for the donor to come and donate blood?
Yes. So first of all, let me tell you that when we say safe blood donation, it has to be safe for the patient, definitely, but also to the donor. Now, how do we make sure that this is safe to the blood donor? First of all, given this pandemic situation, we make sure that we follow all the important steps, like wearing a mask, sanitizing the surfaces and the hands very frequently after touching the surface, and also maintaining the social distance even during this. So that way donors need not feel scared of approaching the blood bank. In our hospital, we have even segregated that blood bank area from the rest of the place, so that donors don't feel scared to come and they don't get infected, or they have the fear of getting infected when they approach the blood bank.
So
once this is done, then we give them a questionnaire. By answering the questionnaire, we are sure that this blood is going to be safe, because the donor would have answered all the questions of his high risk behavior very clearly. This is the next step. The third step is a mini physical examination is done for the donors. Like, we check the blood pressure, pulse, the weight and the hemoglobin. There are certain criteria which the donor should fit into before we can accept him as a blood donor, so that he is not harmed in the process. He is again safe. The phlebotomy procedure per se, that is the procedure of collecting the blood, that is also equally safe. We use sterilization of that area, and we collect blood in a disposable bag with a fresh needle. There is no reuse of the needle or the bag. So you can be rest assured that there are many myths going around that I will get infected if I go to the blood bank to donate blood. No, that is wrong, because every donor gets a new disposable needle and blood bag. So there is no question. and even after the donation you can be sure that you will be taken care of adequately. You will be explained what are the adverse effects one can face. So you will be given adequate care, a refreshment, you stay there for a while and then leave the blood bank. So that is the way it is safe for the donor.
Correct. So can everyone donate blood, or is there only a particular criteria of people who can come to donate?
Yes. Now government has come up with these guidelines. On the NACO website there are these guidelines for every eligible donor. Now certain physical conditions are taken into account, like the weight should be more than 45 kgs at least, or 55 kg based on how much blood we are going to take. The hemoglobin, it should be more than 12.5. The blood pressure, the pulse, all these guidelines are given in detail in this eligibility criteria. When it comes to platelet donation, then again we look at the platelet count. It should be more than 180 or 2 lakhs. This is appropriate for the collection of a platelet. So these are well defined eligibility criteria for the donors. They should be free from any infections. They should be free from certain heart diseases, endocrine diseases. Every other question is answered in there.
So for all those who are unsure about whether you can donate blood or no, there's nothing wrong in stepping out of the house, because they have this entire screening procedure, so they will know whether you're eligible to donate blood or no, only if you step out of your house.
Yes.
Okay, so how healthy or how frequently can you donate blood?
Yes, it is actually very healthy to donate blood. The frequency is defined based on the components. So your red cells, the red blood cells in your body, they regenerate every three months. So that is why the frequency between 2 whole blood donations should be 3 months. Whereas when it comes to platelet, they regenerate even faster. They can regenerate within 72 hours. So a platelet donor can donate even twice a week. So there is a well-defined frequency at which you can donate blood.
Correct. So as she has mentioned so clearly, that the one bag of blood you donate is separated into so many components. So you're not saving just one life, but multiple life, depending upon which component is being used for which patient.
Absolutely.
Correct. What is the time required for blood donation? Because everyone is so busy in their life, whether they have enough time to come to the hospital and donate blood, like how much time does one require?
Definitely. At this point, I would really like to thank all the blood donors once again for taking their time out and coming and donating blood. But the actual procedure of the whole blood donation just takes 10 to 12 minutes. The remaining time is maybe around another 20 to 30 minutes will be taken for filling in the questionnaire, signing the consent for blood donation, then doing the phlebotomy procedure, the minimal physical health checkup, the phlebotomy procedure, and post-donation care. That is for another 10 minutes. So overall less than 1 hour you can say. But when it comes to platelet donation, the procedure is a little longer. The procedure itself takes about 45 minutes. So and the testing is done even before collecting the blood. So here the total duration will be about 2 hours.
So for all those who can afford to spend time on Netflix and social media for 2 hours, can surely come and donate and spend this time in the blood bank. Because right now there's really a dearth of blood bags in the bank. So hopefully you can contribute to the cause. Okay, as Dr. Jayashree mentioned, that there's certain testing that is done before blood donation to make sure that the blood is safe and it is not infected. So what are these tests that you are doing?
Yes. So as soon as the blood is collected, we do certain tests like blood grouping. Now many times we come across donors who think their blood group is A, who think their blood group is B, but actually on testing we find definitely that there is a discrepancy in their thought and the actual blood group. So first and foremost, because any wrong blood group transfusion can be fatal to the patient, so that is why we take care to see that we recheck the blood group once again after it is collected and before it is issued to the patient. Apart from this, we do a testing for the antibody screening. So here both the patient as well as donor's blood is screened for unknown antibodies to these minor blood groups, so that there is no minor reactions also. The third and the most important thing is the transfusion transmissible infections. Government has given us guidelines to test for 5 of them. The viral hepatitis virus infections like hepatitis B and C, HIV, malaria and syphilis. So these are the different infections for which blood is screened. We use different methods for this. There is ELISA, there is chemo. Different methods are used for this.
Okay, so when you say different methods, what about those people who are probably in the initial stage of infection and the methods that you are using in the lab cannot detect them?
A very valid and important question you have brought about. So to answer this, I must tell you there is a terminology called window period. So when the donor gets infected, we do this testing by ELISA or chemi wherein the antibodies are measured. And there is definitely a time gap from infection to the development of antibodies, which is known as the window period. This is called seroconversion. So these methods will not detect the infections in the window period. So what happens is we use another test called as NAT testing, that is nucleic acid amplification testing, by which even small viral loads can be picked up, thus reducing the window period from months to days.
So the blood is made sure that it is extremely safe to be transfused, because the normal methods that are used in other labs for testing these infections sometimes can be missed, but however our hospital does the most sensitive method in testing this, so to make sure that the person who is getting your blood will also be safe from any infection.
Yes, and that too, this NAT testing is not yet made mandatory, yet we are doing it for safety of our patients.
So once you collect this blood, what are the various indications, like when is it used for? Where is it going, this blood?
So as I told you, the different components of blood are used for different indications. So when you need only to increase the hemoglobin, the drop in the hemoglobin may be because of sudden blood loss when you meet with an accident, or there is bone marrow suppression. So during this time you give only the packed red blood cells. But when we come to plasma, there are different indications for that. When there are less clotting factors, then when there are excessive bleeding due to burns or DIC. And when we come to platelets, it is a very well-known cause of low platelet is the viral infections like dengue. So when it drops to very low fatal, this one, then we give platelet transfusions.
So your blood can be used to save so many different conditions.
Yes.
Okay. But is it safe to donate blood to your family?
So most of the times, as I told you already, people approach the blood bank when their family is in need, and they think that they should be donating to their family members so that they know it is safe. Agreed, it is safe. But then there is one condition known as the graft versus host disease, which can occur if you donate to your first degree relatives. Now what is this graft versus host disease? So when it is a first degree relation, the lymphocytes, the WBC lymphocytes, which from the donor, when they enter into the recipient may fail to recognize it as foreign and fail to kill it. So these lymphocytes can in fact be harmful to the patient. So that is why we do not encourage donation between the family members, especially the first degree relatives. Though you can donate when your family member is admitted, but your blood will be used for some other patient, and your family member will be provided blood from our stock.
Correct. So when your family member needs that extra blood from someone else because you can't donate, that is why we need to promote this voluntary blood donation, because as she said, there's so many times that you approach blood banks only when you are in need. So when you donate blood, you sort of have an awareness where to go to donate blood, so you also know where to get blood in cases of emergency for your family members. Correct.
True.
So when you said there are certain rare blood groups, so what do you mean by these rare blood groups, and what are the different blood groups that people have to keep in mind to know about that? So
most of us are aware of the common blood groups O, A, B, and AB is a much rarer blood group among the ABO blood groups. Not only the blood group, you also associate it with the RH factor. You call it O positive or O negative. This is based on the RH. So compared to RH positive, the RH negatives are much less.